Hello everyone, my name's Carolyn Seton and I'm going to talk to you this afternoon about my PhD project. So as you can see here, Digital Division to Social Inclusion, and this was a project that I was lucky enough to be involved in conjunction with Department of Family and Community Services, and which has been run in their Housing New South Wales communities within the Coffs Harbour region. And one of the reasons why I was lucky is this project was already funded. It's a cross-discipline project working with the School of Psychology and so on here, and funded by ACAN. So the actual Digital Age project itself, it was investigating digital literacy strategies. So looking at that within the public housing environment and situation, and that's predominantly older Australians living in that environment, typically low socioeconomic as well. What I did as part of that project, I held a long series of very intensive on-site interventions. In fact, I went out and I did over 70 morning and afternoon teas out on site. So many hours of training, a lot of social content within that, and that was run over a period of 7 months, so it was very intensive. And the predominant question that was needed to be asked as part of the original funding was, can technology help improve people's feelings of connectivity, health and well-being? And to do that, I established a series of different data collection methods. The baseline survey, which was very extensive, talking about demographics, looking at their computer usage, software usage, as well as their levels of self-efficacy and connectedness with their community and family and so on as well. Through the series of interventions, a number of post-intervention surveys were done to measure changes in that. I also collected usage data. So in fact, as I'll talk in a moment, I installed computers in one of those environments with the internet, and also provided tablets to those people, and these collected their usage data. There were also observations, focus group, and also a final survey to non-participating residents in the communities as well. All of these interventions were done, or majority were done at one of the community sites, and there were 2 other sites that we used as controls. It wasn't a highly structured, controlled experiment, but this allowed me to at least evaluate some of the impacts of things such as the social content. 72% of those people that responded to the surveys were over 55, and 23% of them had never used a computer before. The reasons they gave were lack of skills, and surprisingly, I can't afford access to the internet was not one of those reasons that was high on the list. So the strategies included putting PCs and tablets and internet, but also very much social activities within that, and the application of cognitive load theory to all of the instructional design and training that was done there as well. So all of those on-site training sessions were simplified, only requiring relevant information, using their past experience and so on. Limited choice of devices and common user interface, so that that simplified that as well. And the results showed, in particular to the research question itself, significant improvements in each of these areas. Increased optimism, even though the psychology person involved related to this said that that measurement never changes. So here we saw an increase in optimism, also feelings of connectedness, both to their community as well as their family, as well as levels of self-efficacy. And some other just general observations. This is so exciting, I want to live another 10 years. This was an 85-year-old who had never used a computer before, and in fact she was clocked at 41 hours a week during the intervention using her computer, and I saw her clock on at 3 o'clock in the morning many times. Ongoing past that, the interventions, they continued to use, and I've been monitoring that well on. But more importantly, or not more importantly, but just as importantly, the weekly social events that they continue to have now and group together for Christmas and so on as well. So this was the community space before the interventions, and this was it during it. And it, according to Family and Community Services, it's really changed a lot of their lives. Thank you.